Yes, hello everyone. I'm CJ Caroline, a student of computer science, doing masters, and I'm presenting my research topic on interpretable machine learning techniques for predicting therapeutic adherence to osteoporosis treatment among clinicians. In this presentation, I'm covering introduction, background and motivation, problem statement, related work, and gap covered, then research questions and objectives. When I talk of interpretive machine learning techniques, these are methods and models in machine learning that provide explanations on how a particular prediction is arrived at to humans for better understandability. So interpretable machine learning has gained a great importance, especially in health domains and in various domains. So there is a need for transparency in these models for explanation, compliance, and easy to debug, as well as trustworthiness. So, when I talk of those models being applied to osteoporosis, this is a chronic disease that is normally characterized by reduced bone density and quality, making bones fragile to fracture. It's mostly common in postmenopausal women, and so this disease it imposes huge socio-economical burdens revealed by different factors and patterns. And liability to meet financial and social needs. Yet it is still increasing among growing elderly and women. Hence constraining healthcare systems. So this calls for urgent need to strategically and sustainably control healthcare costs of the elderly. So this disease is common among women. The ratio of 1 to 5 women and 1 to 5 women, then 1 to 3 men contract this disease after the age of 50 years, over the age of 50 years, as well as the pregnant mothers. So there is a need to come up with interpretable machine learning models that will predict the adherence of treatment of that disease. Earlier machine learning models were in a black box, like there was no sufficient interpretation, but with the advanced field of machine learning, we can now models. So my problem statements, the perceptions and experiences of patients during treatment greatly affects the adherence to clinical disease, yet it is extremely unpredictable. Hence, there is a need for interdisciplinary collaboration to improve long-term treatment approaches. Then the use of machine learning models to predict therapeutic adherence to osteoporosis treatment among chronic patients in order to develop strategies to improve adherence to medications individually. Then there is a need to comprehend and trust results and output created by the machine learning models by employing those interpretable models. So the related work, I happen to review some of the papers and the work that has already been done so far. Machine learning algorithms have been deployed in predicting various aspects in medical field. Use of medical claims data for adherence prediction, identifying postmenopausal women are at high risk of osteoporosis, then predicting short-term fracture risks, interpretable machine for pathological complete response. However, most of the research that I came across was aiming at the non-adherence and other dynamic associated factors, but it was not rather tackling the interpretability of machine learning techniques for predicting therapeutic adherence to osteoporosis treatment among chronic patients, and that is what I refer as my research gap. So I have some questions I am liable to answer by the end of this research. How do models reach at the predictions of therapeutic adherence to osteoporosis treatment among chronic patients? There is a need to understand how the models predict which factors contribute more to such what are other dynamics associated with predictions and adherence to osteoporosis is how do different demographic patterns influence non-adherence to osteoporotic therapeutic treatment. All that will be covered by the end of my research. So my objective here, I want to develop and deploy interpretable machine learning techniques like LIME, SHARP, and others for predicting therapeutic adherence to osteoporotic treatment for physicians, then optimizing the models with various sampling techniques for the imbalanced data on osteoporosis, then evaluate the performance of the model accuracy. And again, I would love to recommend the most accurate machine learning models and techniques for adoption and deployment by the researchers, physicians, and other participants. So, in conclusion, I really propose developing an interpretable machine learning techniques for predicting therapeutic adherence to osteoporosis treatment among chronic patients in order to enable predicting risks of non-adherence based on their historical data, behavioral patterns, thus allowing adherence improving interventions by physicians and researchers. Thank you so much for listening.